we may have avatars or digital twins in the future. This leads to standardization and harmonization of different tests, laboratory information system, data integration, and the working on e-health systems will be very important for the future and will bring us big success. My name is Egon Amann. I'm a molecular biologist, studied in Berlin, Free University, biology, biochemistry and molecular biology. And I'm doing some consultancy in life sciences, quality systems and clinical chemistry. The industry today is, of course, shaped by artificial intelligence, and this will not spare the diagnostics industry, but it will definitely be more guided by artificial intelligence steps. So that, in short, means for the clinical chemistry director and staff and people to learn much more about artificial intelligence application. I do not think that there will be drastic changes concerning machine-human interfaces. The interfacing will be quite similar. However, the data interpretation and the result interpretation will be done much more in the future by using such new technologies like artificial intelligence. Data integration will be very important, certainly for the next 10 years. And these disappearance will be enforced in a certain way by the new technologies. So let's say if we talk about e-data, patient-specific data, which will be on some servers, which will be in the cloud. We may have avatars or digital twins in the future. And this means that the data from all kinds of sources, be it imaging, be it clinical chemistry, even psychological disorders, everything may show up in our digital diary and digital databases. And this is forcing in some way the different disciplines to fall not completely apart, but to diminish, to go back. And that's good in the sense of the patient health. The idea is basically a complex system which reflects all diseases within a certain given patient. There is one thing which I find important. We have so many different companies in this arena, and Mindray is certainly one of the most active companies also concerning innovation. However, there are laboratories which have many instruments from different vendors, from different manufacturers. And the question is, how can they interact in a laboratory information system better? I would hope for the future that such LIMS become even more efficient and become even more better when it comes to comparing different results from, I just make an example, just take high sensitive troponin from different vendors. And this leads to standardization and also harmonization of different tests. And I want to come back to an earlier statement that I have done on these so-called digital twins. So the question is, do I have the right data, the right diagnosis at a certain stage of my patient? I'm talking now as a physician. And this data needs to be correct. So again, laboratory information system, data integration, and the working on e-health systems will be very important for the future and will bring us big success. One of the good things for our whole industry is the standardization. So there is the ISO standards for most worldwide use. One of the big problems is here that not all countries have the same resources, in particularly the financial resources needed to go through these steps. So in a recent survey, IFCC Task Force for Global Lab Quality, we actually found out that yes, all countries participating, more than 90, saying we have those standard and also the regulation for our country, but the same say about only 50% of those are really implemented. So there is a gap between the regulatory standards and the real implementation of those standards. This gap should become smaller, but it's very difficult. And this is basically resources. So this is a gap which will probably not disappear in the coming years, but there is a good chance that, let's say, resource-rich Western countries can do something about in limiting and not closing, but making this gap a little bit smaller in the future. The first one is not just a keyword, but a whole sentence. The overall cost expenditure of clinical chemistry is approximately 5% from the whole medical health cost incentive. So I think that should go up in the future. Second one is that the industry is a very solid industry, a very matured industry with a great foundation, and will thrive in the future, definitely. And the third point is for the whole industry that if we become more efficient, more cost efficient, more quality concerned, and we will have more tests. I think the first impression is that Mindray is really combining this knowledge in an excellent way. Second impression is that they have a continuous improvement of their instrument line over the previous years, and this will go also nicely into the future. And the third one is certainly data integration and sample processing and combining different instruments in the so-called lines. These are the key three elements that cross my mind. And I was told today, for example, that let's say the reference laboratories worldwide, not just in China, is an excellent step forward to actually get new customers to the product which Mindray already has. So Mindray should go this way further with the reference laboratories, which is extremely important.